So Dr. Nikunj is going to talk about that, the uses and limitation of smartphone.
So good morning to all, and I would like to thank Team UC and AIOS for giving me the opportunity today to talk about smartphone as an imaging device and uses and limitations. So uh, everybody has a smartphone, right? I mean, you don't need to, like from chai wala, sabzi wala, everybody has a smartphone. So it's not like that it has a limitation that owning a smartphone, but how to use it is important. So these are the images. I'm going to show it in few more also at the end. So all are taken by this phone in the center, that is OnePlus 5, which is a dear phone to me. I still have it, but there are no financial interest, of course. But I'm going to show how I have integrated that in my clinical practice when I was learning, and I have like tremendous data which has helped me grow. So, all right. So, smartphone is it is not just a phone. It is actually a phone, plus it is your laptop, it is actually a television, it is also a camera and more, and it is also a reading device. So you can choose how to apply it in your clinical practice, or and you can have your EMR and all those stuff based on AI and ChatGPT. My friends have covered. So there are so many publications recently with the use of smartphone in ophthalmology. It is very important tool if you are working in a setup where you get a referrals from your primary centers in the peripheral, so somebody can take image and send you on the phone just by taking on the phone, and it is easier to send on WhatsApp or whatever transferring channel you use. So it is easier to give that teleconsultation, but yeah, obviously somebody has to be trained to take those at least good photographs from the patients. It has been also been used for microscopic image in the microbiology, and that in that field also it has excelled. And somebody, I don't know the name, but there is a good publication. They have used IOLs and attached it to the iPhone camera, and they have taken wonderful images. So I mean, innovations and sky's the limit when you want to use smartphone as an imaging device. But I'll be just sticking to the clinical aspect of it. So any photograph which requires basically I would say three things that one is object, one is camera, and one is light. So I mean, you don't need to learn everything about ISO and shutter speed. I mean, you don't need to be a professional level photographer to take a photo from a smartphone, because smartphone does that for you. But at least you need to understand what is the what kind of light it should be. For ophthalmology, I would say universal rule: just keep it in the dark room. You will get a good image with your phone. As simple as that. So there are multiple phone adapters now coming which can be attached to the slit lamp. So one is from no financial interest anybody. So Remedio has come up with a beam splitter in the which you can attach in the slit lamp between the eyepiece and the optical part, and then you can attach that is actually only for the iPhone. They have some collaboration with iPhone, so you can only use iPhone which they provide. You cannot use your other phone, and it gives a fantastic image. But it also uses a beam splitter. But what happens with the beam splitter is it actually splits the light. Only 10 to 20% of light goes to the camera, and rest of the light comes to your slit lamp. So whatever you're seeing is whatever the camera is getting. So it is actually less light. So I mean, kind of you are compromising on the illumination there and there. So there is another company which has come up with just a slit lamp adapter to hold your phone. There is nothing else. It is just an adapter to hold your phone. You just have to adjust first time that when your camera is in the alignment with your eyepiece, and every time you just have to click a picture, you flip it down, put your phone, take a picture, flip it up, and it again becomes your original slit lamp. And this was some old device when iPhones were also like in iPhone 4 level. So Dr. Fogla sir has also shown this in one of his videos there on YouTube. So there is kind of an eyepiece kind of structure attached to it. So it is devised by the company called Killer, but it is like there is another DIY version of it. You can just use some bottle-like structure with the they have used the shaving kit base, and then make a eyepiece and connector, and then you just apply it in the slit lamp. But you need to remove one of your eyepiece and then click the picture with your phone. So there are multiple ways you can click the picture, and ultimately what important is that you need to have a better clarity image, so that you can show it, and you can even show it to the patient, show it to your colleagues, and discuss whatever the way you want to. Smartphone now is also used as a video surgical device for microscope. We are using one from the Remedio, and it is giving fantastic video recording system. This is the video just to show. I'm not going to show the full video. So you can see this is the maximum zoomed out field of vision. There is only limitation which I felt with this particular model is that they have, after all, for microscope you need to use a beam splitter in between, because you need to use the microscope when you are recording. So there are like you get this round edge, which is one thing that I don't like about this one. But otherwise, the quality, resolution, you can even record 4K recording with this. So this is just a case of acute hydrops. I was doing some small procedure and just to show the recording. There are so many fundus cameras nowadays, like with handheld and stuff. But all you need in your clinical practice, if you want to take a fundus photograph, is just 20D, which all of us, generally have, and a camera. So with just 20D, and there is a publication by a team from China as well, and few more, that they take a 20D and a smartphone with flash on, and you just take an image right there and there. Of course, there is a limitation that the field you get is limited, and you cannot. It will be difficult to get the peripheral images in this kind of scenario, but posterior pole is easily, doable. I'm an anterior segment surgeon, so I think Dr. Kushagra is there. He's our VR surgeon at SRJ Netrala. He does that, and he will be able to share his experience more. So I talked about few adapters and this thing, but personally I don't use any. I just use the camera, and slit lamp is there, and how to take a photograph using nothing just for apart from your camera. I've made a short video for that. So I'd be grateful for my staff to help me with this video. So first thing is, obviously you need a cooperative patient. It will be difficult when you have a child as your patient and you want to click a picture. It is even difficult with you if you have a already established slit lamp imaging device. So first is you set the patient. So I use just 2 fingers. One is resting on the eyepiece, and other one is the index finger is actually guiding and holding my phone, and I'm actually moving my phone with the camera right and left, and you just wait when the image is actually formed, and you know where the image is, you are getting the image, and you need to be ready with your other hand on the click area with the thumb. So once you get an image, you need to hold the phone in a correct position, and you just click a picture, and that's it. So with the smartphone advantages are you don't need to worry about other parts of like illumination and stuff. So you can see the image, which is quite clear, and it is actually a slit image. So these are the few images which I have taken. So this is a subluxated case of cataract with anterior subluxation of the cataract, then viral keratitis, iridodialysis, a toric IOL in place, one of the peritoneal keratoplastic graft, ruptured anterior capsule, phacomorphic glaucoma. So you can see in all images there are different kind of illuminations, and all these images are taken by just phone, nothing else. And if you like good images, I have made an Instagram page. I am not able to give a justice right now after becoming father, but there are very good images there which are all taken using just a smartphone on slit lamp. So advantages are that it is easily available, it is repeatable, it is portable. You can integrate teleophthalmology with it, which is the biggest advantage I personally feel. AI integration would be another level of using the smartphone as an imaging device. You can directly store the data on cloud, so you don't need to worry about hard drive and stuff. And transfer is also easy. But limitations are when you have an uncooperative patient, obviously it will be difficult to use. And after all, it's an iPhone or it's a smartphone, so any operating system can crash and you can lose the data, but you need to have a backup. And also the camera longevity. So any phone will get tired with age, and the camera will lose its clarity and stuff. So that needs to be replaced. When you can replace just a phone and you are good to go. So there are future applications. People from Shankar Netralaya with Microsoft, they are working on it, I think, and they've published already. So it is actually 3D printer made Placido disc model, which is used with LED lights, and it is actually just smartphone based corneal topography. So actually you will be able to do topography where in a camp patient where you are suspecting something, that it could be a keratoconus patient, and you might be able to give a better idea that he might be the keratoconus patient. You can bring it to the hospital, but the sky is the limit when it comes to using a smartphone in a smart way. Thank you so much.
Thank you so much, Dr. Nikunj, for the wonderful talk. And just before I invite comment from Dr. Kushagra and Dr. Pratyush, Dr. Aarti ma'am, you can set up the talk. So what I do for localizing, I'm not using any adapter. What I do is when you go back 2 centimeters from your eyepiece, you will see a small dot of light that is where the image is forming. So you just follow that dot, and when you go near it, it'll just keep magnifying and it'll show the image. So near the ocular, if you are just moving the iPhone up and down, it sometimes might scratch the ocular surface and the binocular surface and your smartphone camera also. So I used to do that. Dr. Pratyush, Dr. Pratyush and Dr. Kushagra's comment on.
So one thing what I do is sometimes when I'm not able to focus properly or get a proper image, or if the patient cooperation is not that good, I switch to the video mode. So when you switch to the video mode, sometimes you just miss that moment where you want to click or you want to get that focus. When you switch to a video mode, you capture the whole thing. Maybe you can, later share it to your laptop and, capture that image that you want to capture.
Yes. So I have recently bought the innovative product that Dr. Ashish Sharma has recently developed for taking retinal images. I'm yet to use it, but I have got the demo from himself. And otherwise, we use the smartphone to capture images from the slit lamp. Yeah.
I think the ease of use is the most. It's readily available everywhere.
Ease of use, readily available, repeatable, and easy to share the image also.
Yeah.
That is also important.
That is
It's
very-
not about just taking the image. You want to, use it.
So.
They apply too much of their AI.
Yeah, they will. Just like if you click a picture, you are fairer than you are actually. So that is actually.
The